Update continues here on One News Now. I'm Riza Diaz. The country will soon have more options for vaccines with the expected arrival of Russian-made Sputnik V on Wednesday. Let's talk more about this with Dr. Nina Gloriani. She is head of the country's vaccine expert panel. She's joining us live via Zoom. Doctora, good evening.
Good evening, Riza, and everyone.
Doctora, first off, what makes Sputnik V different among other vaccines that we have based on your evaluations?
Okay, it's not that it's different. It's the platform using yung adenovirus as vector uses two types of adenoviruses, the adenovirus 26 and 5, whereas the other vaccines that are also vector-based use the same adenovirus for the first and second doses. That's the only difference.
Doc, the Department of Health says the shot would require special storage. Can you expound on this more? And which LGUs will be capable of storing this?
Well, they will require minus 15 to minus 25 degree temperature, yung storage, no? So that's around minus 20, which is the freezing conditions. So it is much lower than what you would require for Pfizer, which requires ultra low, but of course it requires frozen state rather than the one we use, yung Sinovac and AstraZeneca, which are stored only in the refrigerator. So handling will be a challenge, actually.
Doctora, going back, do you have already a list of the LGUs that can actually receive these vaccines?
No, actually, there was a meeting held, I don't know how many weeks ago, to roll it out in only a few LGUs in the NCR first, no? Because the vaccines that are coming will be around 15 to 20,000 doses only. So that will make yung sort of simulation to actually roll it out using the minus 20 storage facilities.
Dr. Nina, we are also expecting more doses from Gamaleya. Now, how can we ensure that the supply won't go to waste?
Oh, I think the government has planned on all of this, cold chain facilities for a long time, for some time, and even for the ultra low. So it's just a matter of orienting and training the vaccinators at the LGUs about the proper handling and storage of these vaccines. So we should not really worry about that. They have been trained. Actually, that was, as I said, a few weeks ago when they started the discussion about this vaccine coming with the supplier itself.
Ma'am, going back to Sputnik V, is it recommended to be administered among all age groups in the Philippines?
Yes, they have data across all age groups. Well, that's 18 years up to, the oldest they tested were about 85, 87 years old. So that's for everyone above 18, so the adult.
Still on Sputnik V, ma'am, are there any reported side effects of this vaccine from abroad that we should be worried about?
Yes. Like any vaccine, no, we have to look for yung mga, the usual, the local side effects and the systemic side effects. And for Sputnik V, if I recall, no, they were able to report only about yung mild cases of this either local or systemic side effects. 94%, I think, nasa mild lang, no? And less than 6% yung grade 2, you grade these different conditions like pain, even fever. So it has a very good safety profile. So other than that, no, like if we look at the issue of blood clots, but these are rare events. There were a few, but these are still rare. So we have to consider all of these rare events, the adverse events of special interest, together with all the other vaccines that we're actually looking at or deploying.
Doctora, last question. What do you think are the aspects that we need or that needs to be improved in our COVID-19 vaccination program?
Oh, okay. The vaccine hesitancy has been addressed a little, but still it's a bit of a problem. So we have to continue to do more communication, all possible sectors. We have to just keep on repeating the message across is, because we get the same questions every time. It's as if there's still a lot to understand about this, but the government is trying its best. So all possible sectors. So what we want to tell everyone is, whatever these vaccines may be, please avail of them the soonest time possible, because we're really running out of time, no? So it's good that we have now another choice, another option, this AstraZeneca, not the Sputnik V, but we are hoping that we will have more by the middle of the year or a little after.
Doctora, we thank you for your time and for your insights. That's Doctora Nina Gloriani, head of the Vaccine Development Expert Panel.
Thank you, Risa.
Now, the Philippines' COVID-19 caseload has climbed to over 997,000, just 3,000 shy of reaching the grim 1 million mark. Just today, the Health Department reported over around 8,000 new cases, pushing the active case count to more than 77,000. The virus claimed the lives of 109 patients in the past 24 hours, bringing the death toll to more than 16,000. Now, some 903,000 meanwhile have gotten better from the disease, with over 20,500 new recoveries reported today. The OCTA research group saw a downtrend in COVID-19 cases in Metro Manila last week. In the latest report, OCTA research said the COVID reproduction rate in NCR dropped to 0.93 from the earlier reported 1.24. This brought down the average number of cases in NCR to around 3,800 this past week, a 20% drop from the week before. However, OCTA research fellow Guido David warned that the improving COVID-19 situation should not be taken as a signal to ease restrictions. David tells Philstar.com that the downward trend is still unstable and is not enough basis to relax the current quarantine status. He stressed that it's possible for COVID-19 cases to increase again if officials will ease quarantine restrictions prematurely. In India's cemeteries and crematoriums as the recent COVID-19 tsunami resulted in record high deaths. Experts warn this may just be the surface as numbers could be higher than reported. Let's watch this report from Bloomberg.
India has blown past the global tally for daily new infections. What it has also blown past is its own record for new deaths recorded each day. On Friday, the country reported more than 330,000 new infections and more than 2,200 deaths. However, data from crematoriums and burial grounds is suggesting that the actual death toll may be significantly higher. As India's pandemic overwhelms its healthcare system and tests begin to get harder to find, it's become increasingly difficult to accurately assess the death toll. And 1 year into its pandemic, India has not been able to fix this data gap. In New Delhi, this is Muniza Naqvi for Bloomberg.
And on that note, oxygen plants in India have scaled up their production as demand continues to remain high. A large queue was seen at an oxygen plant in Lucknow City, with people visiting the plant in the hopes of getting some gas for patients. Oxygen production and filling facilities down south in Kerala state are now only focused on filling up cylinders for medical oxygen. Indian Prime Minister Narendra Modi has stressed the immediate need to augment the supply of medical grade oxygen and other equipment required for patient care. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.